Hello, everyone. Welcome to the Dial-Up program. It's for Diabetes Impact Academy for Lifestyle Utilization and Prevention program. And what we do is we try to focus in on group visits combined with individual visits and remote tracking that focus on all aspects of health and diabetes. So the foundations are nutrition, behavioral, spiritual, activity support, accountability, and tracking. And what we want to do is provide as much value to our diabetics to help use lifestyle techniques and functional medicine to defeat diabetes. And so this presentation is on the complication of diabetes mellitus. Just a quick outline. We're going to go over diabetes complications of the skin, the eyes, nerves, feet, kidneys, something called DKA and HHNS, which I'll get into later, strokes, heart disease. And the references for this are from the American Diabetes Association and its website, as well as the Center for Disease Control. And this program adheres to the Diabetes Self-Management Education and Support Standards. And so let's get right into it for diabetes and skin. Really, your skin talks to you daily. When you look down at your skin, look at the texture, look at the color, there are a lot of things that it says. And in terms of diabetes, one of the most common things that we see is something called acanthosis nigricans, which is the tan or brown raised area appears on the sides of the neck, armpits, and groin. So the picture on the left, you see on the armpit, you see the darkening that's right there. And then on the right, you see the neck. This is one of the most common things that we see in people, even if they're not diabetic, whether they're pre-diabetic or they're insulin resistance and obesity. Starting to see a lot of this in children as well, which is concerning for insulin resistance in children and childhood obesity and even childhood diabetes. This is something called diabetic dermopathy, which are kind of light brown scaly patches. And the mechanism behind this is that there's some small blood vessel inflammation, and it could be oval or it could be in circular fashion. And then this fancy word, NLD, necrobiosis lipoidica diabeticorum. It starts as like a dull red raised area, and we see this quite a bit too on the shins. And what happens is it kind of looks like a shiny scar, and the blood vessels underneath the skin can actually show through. Sometimes it's itchy, mostly not, and sometimes the spots and the rash can even crack open towards the middle or towards the raised edge. This is something called digital sclerosis. It happens in many diseases, but the most commonly in diabetes, and it's kind of thick, waxy skin that are really tight on the back of the hands, and it's painful. It's hard for the joints to move, so they become really stiff, and that is not the most comfortable thing. And we also have skin infections that we see in diabetes. So on the right-hand side, you kind of see the leg cellulitis, which is basically an infection of the skin. And other sources of infection of the skin are styes, which is infection of the eyelid glands. Boils, folliculitis. Folliculitis is inflammation of the hair follicles. Carbuncles are kind of like little abscesses on the skin that goes deeper into the tissue. And infections around the nails, it could be fungal infections like toenail and fingernail fungus and candida overgrowth, or it could actually be bacterial infections around the nails, which may or may not need an antibiotic. So whenever you look at the skin infections, we want to be able to make sure that if you see anything that starts to be reddening, you go see a doctor immediately. Even 1 or 2 day delays for skin infections can have some serious consequences. Let's get into diabetes and the eyes. So the relationship between diabetes and the eyes are multiple factors. And the first factor I want to talk about is increased eye pressure. So people with diabetes are 40% more likely to suffer from glaucoma, which is this increased eye pressure. And in fact, the longer someone has diabetes, the more common it is. And when the pressure builds up in the eye, the pressure causes drainage of the fluid in the eye called aqueous humor to slow down so that it builds up into the anterior chamber of the eye or the front chamber of the eye. And this pressure can pinch off some blood vessels that carry the blood supply to the retina and the optic nerve. So the retina exists in the back of the eye. It's where you receive visual information. And so whenever you damage that, it's something called retinopathy, which I'll get into in a bit. But also, with the high pressure in the eye or this glaucoma, you can have something called optic neuritis or an optic nerve damage. The optic nerve's job is to connect the eye and the brain for signaling. And if that is impaired, people can have some significant visual deficits and blindness. Cataracts are very common, even those people without diabetes. But diabetics are 60% more likely to develop cataracts at a much younger age and have significantly faster progression. And with cataracts, the eye's clear lens clouds blocking the light. So you kind of see in this picture from the Mayo Foundation in the top right here, where the patient's right eye, our left, his right, is very murky looking. Those are cataracts. And this is a person who is having a dilated eye exam. So there's medication that is being dripped into the eye that causes the dilation of the pupils. So it could be examined by the ophthalmologist. And ophthalmology examinations is exceptionally important in someone who's diabetic to look for things like cataract and glaucoma, and this, which is retinopathy. And retinopathy comes in a couple of different forms, but retinopathy, the word comes from retina, which is the receptors at the back of the eye that you can see. And opathy, which is basically an impairment of or disease of. So retinopathy is the disease of the retina. So if you look at a picture on the left-hand side, that's what a normal retina looks like in a dilated eye exam. On the right, you see a lot of differences. You see some areas of bleeding, some blotchy areas. Those are blood. In retinopathy, there are two major different types. One is called non-proliferative, and the other one is called proliferative. Non-proliferative, basically, the blood vessels in the back of the eye balloon and form little pouches. And proliferative, it means that these blood vessels are so damaged, they close off and new blood supply started growing in the area. So that is the definition of a proliferation of blood vessels, where the blood vessel starts to grow. So ultimately what happens is that these blood vessels start leaking and they can block vision and form scar tissue. Now, one thing about scar tissue is that as the scar tissue is being formed, it can damage the geography of the retina, and detachment can occur. And retinal detachment and causes a major blindness. So once again, really good idea to get your eyes checked out by the ophthalmologist. Diabetes and the nerves. What are the connections between diabetes and nerves? So neuropathy comes from the word neuron, which is a nerve cell, and opathy, basically an impairment of the neurons, exists in 50% of diabetics. And it's a lot more common in those who have the disease for a number of years and can lead to significant issues. So most people, when they think neuropathy, states that it can be numbness or pain in the feet, but it can occur in hands as well. And so whenever you look at the feet, there's a lot more things that can be damaged other than nerves. So I really want to dive into that. So aside from nerve damage in the feet can also develop some foot ulcers and infections. And these are most often on the balls of the foot or on the bottom of the big toe. Even though some ulcers don't hurt, every ulcer really should be seen by the healthcare provider right away. Because it is extremely difficult to tell which ones are dangerous, meaning which ones can lead to infections, and which one can hide bigger issues without being seen by a healthcare professional. I do recommend seeing a foot doctor once a year to evaluate your feet for not just foot ulcers and infections, but also neuropathy. And neglecting these also can result in major infections, and it ultimately can lead to amputation, loss of limb. It can also lead to something called osteomyelitis or bone infections if it goes deep enough. And then when it gets into when the infection gets that deep, a lot of times there's not enough healthy tissue around in the area, and so amputation could be very imminent. And high blood sugars chronically can certainly do this. It's probably the most common cause for this to happen. And so I touched on neuropathy and foot ulcers the last few slides, and I really want to connect that together. When you have nerve damage, you have issues with sensation in your feet. One of the reasons is that blood sugar affects not just the nerves, but the blood vessels and all the tissue around you. And the longest nerves in your body go from your spinal cord to your feet. And so it has a lot of surface area damage. Same thing with the blood vessels. The longest blood vessels in your body goes from your heart all the way down to your feet. So a lot of surface area to be damaged as well. And of course, we talk about blood vessels. This is a poor circulation in the feet. Now, diabetes, there's several factors in diabetes that actually can damage blood vessels and blood flow, and can cause impairment in blood flow by creating inflammation in the actual blood vessels. And those who are diabetic also have a depletion of something called nitric oxide, which actually dilates the blood vessels. But fortunately, a lot of this can be prevented earlier on by eating some food that helps improve nitric oxide, like leafy green vegetables and purple dark color vegetables and beets as well. And so circulation issues can lead to ulcers and pain and discoloration. A lot of times circulation in the feet that's impaired will not have any pain, and sometimes it can start off as pain. And as the pain goes away, people think it actually gets better. What's happening is that the circulation is disallowing the healing of the nerves in the area, so you can't feel what's been damaged. And diabetes in the kidneys. The kidneys are the master filter of the body, along with the liver. So the nephropathy, nephron basically are units in the kidney that filter the blood, and opathy once again means damage or disease. So diabetic nephropathy means diabetic kidney disease. And high levels of blood glucose or blood sugar damage these filters in these kidneys. So if you think about a filter as something that's having a lot of little holes in it to allow fluid to leak through, but that filter prevents a lot of sediment to go through, kind of like a coffee filter, right? Coffee filter allows the liquid to pass through, and but it keeps the coffee in. So as that happens over and over again, glucose can actually sort of poke holes into the filter. And what's happening is that larger molecules leak through, like protein, and this leads to a lot of swelling in different bodies, even though the filter is being damaged, allowing allowing urine to leak through. What's happening is that protein creates something called an osmotic pressure gradient. What that really means is that protein is allowing your body to keep a lot of the fluid inside its blood vessels rather than leaking into different areas that's outside the blood vessels. And in medicine, we call that third spacing. So a lot of times we look at people's legs, look at their swelling. If people have long-standing kidney disease or diabetic nephropathy, they tend to lose a lot of protein. And the more protein they lose, the more swelling they get. And they retain water into the different tissues in their body, but inside the blood vessels, it's very depleted because of the lack of protein. And so this can be a very serious consequence, can lead to something called end-stage kidney disease and lead to dialysis. And so screening urine checks are recommended annually as well. Diabetic ketoacidosis is a condition, and it's usually a medical emergency. But this condition is where the body can develop something called ketones. And these are not the same ketones we're talking about when we're talking about like a ketogenic diet, where we're talking about going to nutritional ketosis, meaning that there's a low level of carbs you're intaking. This ketone is very deadly, it's very acidic, and it drops the pH of the blood. And it is a medical emergency, and we admit a lot of people into the hospital, into the intensive care unit for this. So it develops slowly, but when vomiting occurs, it's a life-threatening condition. And early symptoms include thirst or dry mouth, frequent urination, high blood sugar levels, and high levels of ketones in the urine. This is typically seen in type 1 diabetics and autoimmune diabetics, but can be seen in severe type 2 diabetics as well. A lot of people who were diagnosed as type 2 diabetics go into DKA and actually was found to have autoimmune diabetes or type 1 diabetes. But this is a deadly condition. It's not very easy to treat in the hospital. A lot of things can go wrong. It's a very delicate balance. So whenever you do see the thirst or dry mouth and frequent urination, high blood sugar, please get checked out by a doctor. And we were able to determine whether or not it is a life-threatening condition. Another version of high blood sugar causing a medical emergency is something called hyperosmolar hyperglycemic non-ketotic syndrome. So basically, it's very similar to ketoacidosis, except that there's no ketones, but people also get very dehydrated. Blood sugar goes very high. And the short name is called HHNS. It's been also called other names in the past. But it's usually brought on by like an infection, an illness, or some sort of stressor in the body. So the blood sugars rise. As the blood sugars rise, it can rise into dangerous levels, a lot of times over 600 or so. And it creates a lot of inflammatory factors, and blood sugar goes to the kidneys, and you have massive urination. So what happens is that even though you're urinating, it doesn't mean that you have too much water in you. It means that your body's trying to get rid of the blood sugar. And as you urinate, you deplete your body and get super dehydrated, so your urine becomes very dark. Sometimes it can even become brown. When it becomes brown, that means the kidneys are seriously damaged. And it can lead to massive dehydration and can be life-threatening. Warning signs of this is blood sugar over 600, like I said before, with extreme thirst, although that may disappear after a while, after your body realizes it's very dehydrated. There's also a warm, dry skin that does not sweat, high fever, sleepiness or confusion, loss of vision, and hallucinations. So a lot of times it could be visual hallucinations where you're seeing things, or it could be auditory hallucinations when you are hearing things that they may not be there. And I'm going to touch on stroke and diabetes and tell you guys how they're related. So a stroke happens when the blood supply to the part of your brain is suddenly just interrupted. The brain damage occurs, can cause movement problems, pain, numbness, and problems with thinking, remembering, or speaking. And diabetics is 1.5 times higher chance of having a stroke. And so the mechanism of a stroke is similar to the mechanism of kidney damage and eye damage and heart disease in diabetics, is where there's systemic inflammation. This inflammation causes a cascade of events to happen where it can create clotting. And when the area of the brain has very small blood vessels that clot, it can cause a small stroke. If there are large blood vessels that clot, it can cause a very large stroke. And strokes, a lot of times, are even silent, meaning that people don't even notice them because it could be so subtle. Sometimes you can't even see it on the MRIs because the blood vessels are so small. We call those TIAs, transient ischemic attacks. And if we do see on the MRI, we do see some major damage, and that's an actual stroke. Nevertheless, it is damage done by the blood sugars. Now, there are multiple stroke pathologies that are not caused by diabetes, but diabetics do get 1.5 times higher chance of having a stroke. So what are the warning signs of a stroke? You have weakness or numbness on one side of the body, confusion, trouble understanding, and trouble talking. A lot of times you will be talking to someone and they say you make no sense. You can have dizziness, loss of balance, trouble walking, trouble seeing out of one or both eyes, and have severe headaches. The headaches are actually not a very common thing. So even if you don't have a headache, you may be having a stroke if you have any of the other symptoms. Please do not downplay signs of a stroke, because if you actually did have a stroke, you only have a few hours to seek help where they can give a life-saving drug. Heart and diabetes. So diabetes and heart disease go hand in hand. In American Heart Association, 68% age 65 and older diabetes die from heart disease, and 16% die from stroke. So heart disease and stroke are very similar because we're still dealing with the blood vessels, except this time we're talking about blood vessels to the heart, and the blood sugar can cause the major inflammation, a cascade of different events, once again, that causes clotting off of the blood vessels. Adults with diabetes are 2 to 4 times more likely to die from heart disease than adults without. And the AHA considers diabetes one of the 7 major control risk factors of cardiovascular disease, the others being smoking, high LDL, low HDL, high blood pressure, physical inactivity, obesity, uncontrolled stress, and anger. And so one of the most surprising things I tell people is that people are significantly higher a chance of having a heart attack shortly after a conflict that's an emotional conflict. The CDC does recommend immunizations for those with diabetes, and the reason is because diabetics are more likely to have infections, and a lot of these infections are hidden. They could be viral infections like influenza or the flu shot. So the flu shot, which is the influenza vaccine, the way it works is that different strains are predicted to have some detriment in an area in the United States. And these strains, because they're predicted, can have a vaccine for that strain. So a vaccine for 1 year is not the same as the vaccine for the following year. Sometimes the predictions are good and sometimes they're not, but nevertheless, it's a good idea to get it with a vaccine, influenza vaccine every year. Sometimes 2 vaccines can come out for the same season if they find that there's strain variation between what's actually infecting people and what's actually in the flu shots. The Tdap vaccine, basically, it's a tetanus shot, we call it. It's a tetanus booster, can be administered every 10 years after the Tdap shot as well. The zoster vaccines for varicella zoster. People know this as the shingles disease, and people age 50 years and older should get the zoster vaccine. A pneumococcal vaccine. 1 dose of a pneumococcal vaccine before the age of 65, and 2 more doses after are just fine. The pneumococcal vaccine, and notice I didn't call this the pneumonia shot. So people call this the pneumonia shot. It's not technically correct because this vaccine doesn't protect you against all pneumonias. Pneumonia, which is basically infection of the lung, actually is most commonly caused by viruses, which this vaccine does nothing for. This vaccine is specifically for bacterial strains of pneumonia, and therefore it doesn't necessarily protect you against the disease of pneumonia, but it's against the organism that causes pneumonia, that is a bacteria, but definitely not viruses. Funguses can also cause pneumonia as well. And then hepatitis B vaccine is recommended for any unvaccinated adults under the age of 60. So preventative eye exams are something that you want to do on an annual basis, based on the fact that you can develop the cataracts and the glaucoma. That's much higher risk in those who are diabetic. An annual foot exam should be used for screening. Dental screening should be twice a year at least, and kidney screening should be at least annual as well. If you have any abnormality in any of these screening exams, the frequency is going to be much more depending on what your medical professional tells you. So, how can you help prevent all the complications of what we talked about. It's a really good idea to what I like to call track it to hack it. Track it means track your blood sugars regularly. And then our team can also remotely track you by giving you some specific tools that sync with our cloud system where we can access that live data. And we want to be able to target a plan of action as you go through these courses and group sessions and individual sessions in nutrition and lifestyle. And we want to target blood sugar range that's appropriate for you. And come to our dial-up group sessions for support and accountability as we go through this. It is very challenging to know just everything, but when you're in a group setting, we all learn together, and there's accountability. It's just much more fun. And if you look at the data, and for those people in the group settings, people are much more compliant and have significantly better outcomes clinically in group settings when it comes to diabetic management.